I'm Dr. David Schultz. I'm founder of MAPS Medical Pain Clinics. And I founded this medical practice in the early 1990s. We became officially MAPS Medical Pain Clinics in 1995, and I've been practicing full-time interventional pain management since then. People with chronic pain often have the need for physical therapy, and some patients have the need for psychology intervention. And I felt like I was only presenting a piece of the puzzle to the patients, and they really weren't able to find that help elsewhere in the community. So I decided to go off on my own and build my own pain clinic where I could incorporate what I do, which is interventional pain management, along with physical therapy and psychology services.
When I was in nursing school, I did an independent study with one of our professors who was doing a research study on treatment of pain in cancer patients. And these were patients who were hospitalized and were having an acute onset of pain. And we went in and we taught them some techniques, some nursing techniques to help manage their pain. And so it was a great experience, and that was my only really experience focusing on pain. And then when I was working as a nurse in ICU after nursing school, I dealt with, again, acute onset pain, but we also had a lot of patients in the hospital who had some chronic issues, and having to deal with both of those issues at once was really difficult. In that type of a clinic setting, we would have 15 minutes, not even 10 minutes, 5 minutes to see patients that came in with pain issues. And I remember the staff at the clinic that I did my training, they would look at the schedule and they would say, oh no, so-and-so is coming in and he has pain issues and we have 5 minutes to deal with all of his concerns. And on top of that, you were dealing with diabetes and hypertension and all the other chronic issues that this individual had. At MAPS right now, we have maybe a half an hour to spend with these individuals, and all we focus on is their pain problem. So we're not trying to set aside a chunk of time just to deal with the pain management issues. We have a good amount of time to only focus on their pain problems.
I've worked in physical therapy for about 15 years prior to coming to MAPS, and in the outpatient orthopedic setting, sometimes with a team, but never with a team that had the interventional components that the physicians do here. So working as a physical therapist side by side with the physicians doing these sorts of pain relieving therapies is really powerful in terms of rehab outcomes. Communication with the team is really helpful in patients achieving their rehab goals. So when we in physical therapy have the ability to quickly check and see what the patient is doing in terms of medical interventions and medications, as well as what they're doing with the behavioral health staff, it really helps us to tie together their physical therapy plan to reach goals more effectively.
I think what makes you happy is you see these patients and they seem so difficult and impossible in the beginning, and a lot of them sometimes even in the beginning won't even talk to you, but once you build that trust and rapport with them, and it's really a lot about education, but once they see that adding that behavioral health or getting them to go to physical therapy just one time, and the communication we have with everybody, and you start to see that patient open up, and actually you find out that the patient is much more happier, their pain relief is done without needing all these medications. And I've seen that with many patients in particular, where actually I've had patients in the past with high doses of opioids. They start on our program, they start tapering off, and actually by the end I've had one that was on huge amounts. By the end he was tapered off all of his medications and felt wonderful.
As a physician, I work a lot with the interventional aspect of pain management. And here at MAPS we do a huge range of therapies, all the way from well-established treatment modalities such as epidural injections, radiofrequency ablation. We also do spinal cord stimulation therapy, as well as interdiscal treatments. And there are many newer therapies as well that are coming out in the field of pain management. And at MAPS Pain Clinics we work with these and try to learn all the newer techniques such as minimally invasive lumbar decompression, and we help patients with that different modalities as well. Here patients with chronic pain come in, and on the initial eval the nurse practitioners and the physicians, as well as the physician assistants, work together to identify the main cause of the patient's problems and pain. But the nurse practitioners and physician assistants here at MAPS Pain Clinics have a very unique opportunity to have autonomy, independence, as well as the ability to work with a physician on any questions or issues that they may have. And we work together as a group to collaborate. And it's kind of an understanding that we both respect each other and we try to help patients out best we can.
We have more time that we can spend with patients, which is a huge bonus over primary care because these patients tend to be complex. The pain management patient typically has been suffering for a long period of time, and many aspects of their selves and their lives are affected by this pain. MAPS has a great approach because we deal with the whole person. We send almost every patient we see to physical therapy, which is a huge part of recovery. We send many of the patients who we see to our behavioral health team, and as I tell all my patients, not because we think the pain is in your head, but because we know the brain becomes involved, especially in these chronic conditions. We use injection therapy when it's appropriate, where we take medication and try to put it right at the source of pain to try to help deal with their pain in that way. One of our physicians always describes it to patients as putting the fire out in the actual location of pain. We use medication of all different types when appropriate for pain relief as well. So that comprehensive program, coming at the pain from all different avenues can have a better outcome than anyone in a primary care setting would have time or the resources available to manage that.
You know, the cliche is you get to help people, and what's nice about it is various ways to help people. And the nice part about the psychology is you get to know people. One of the nice things about our appointments is they're an hour long, and so you really get to know people on a personal level. And that's what attracted me to particularly psychology, is understanding how people work. Think of it as coming to see somebody who's on your side, who's an ally, somebody who can figure out how to navigate through this together. Again, a lot of people coming in are told it's all in your head, get over it, move on. I've got back pain too, but I still go to work. And it can be very challenging. People don't get it, in a sense. And part of us in the behavioral health, and actually all the providers here as a matter of fact, but us in particular, we have time to kind of sit with a person and understand where they're coming from. And not only the pain itself, but the context of the pain. How has the pain affected you? Wow, it's really changed you as a person. It must be really hard understanding you used to be like this, now you're like this. And so it's kind of like a relationship where we listen, we understand, and we kind of help the patient make the decision of where they want to go.
What's really great about the chronic pain program at MAPS is that it's not only the chronic pain team working together, but also physical therapists, behavioral health, and invasive. So it's really a team effort to take care of the patient, empower them, give them the tools and education that they need, and so that they can become more active in their life.